Hey, everyone! Welcome back to the CPR Business Mastery channel, your ultimate source for all things health and safety. Today, we're delving into a critical aspect of CPR that lays the foundation for effective intervention, checking for a pulse. Whether you're a first-time viewer or a long-time subscriber, you're in for some valuable insights. Stick around as we explore the essential steps in checking for a pulse during a CPR session. Let's jump right in. Alright, folks, before we get into the nitty-gritty of chest compressions and rescue breaths, the first step is assessing for safety, then check for responsiveness. Checking for a pulse is a crucial step in assessing a person's condition, especially when determining whether to start cardiopulmonary resuscitation, CPR. The current guidelines from organizations such as the American Heart Association provide the following recommendations. Unresponsive person. If a person is unresponsive and not breathing normally, begin CPR immediately without checking for a pulse. The emphasis is on starting chest compressions early to maintain blood circulation. Responsive person. If a person is responsive, you may check for a pulse to help determine the need for CPR. Carotid pulse check. If you need to check for a pulse, use the carotid artery, located on the side of the neck. Place your fingers on the groove between the windpipe and the large muscle on the side of the neck. Check for a pulse for no more than 10 seconds. If you don't feel a pulse, or if the pulse is weak and the person is not breathing normally, begin CPR. Brachial pulse check, for infants. For infants, if you need to check for a pulse, use the brachial artery, located on the inside of the upper arm between the elbow and shoulder. Remember, the primary focus in an emergency situation is to start CPR promptly if the person is unresponsive and not breathing normally. If you are unsure about your ability to detect a pulse or if you are in doubt about the person's condition, err on the side of starting CPR. Early intervention is critical for increasing the chances of survival in cases of cardiac arrest. Let's help save a life one victim at a time. See you in our next video.